Hello, and thanks for joining us today. I'm Jeff Henrich, the CEO at Guest House. 2020 has been an interesting year. All of us have had our lives change pretty dramatically. The thing that hasn't changed is the need for addiction and mental health treatment. So far, Guest House has remained COVID-19 free. I have invited the Guest House clinical team to give a presentation on how Guest House is keeping our clients and our staff safe. As long as Guest House is open and clergy and religious need treatment, I want Guest House to be your safest and most effective treatment option. I'm going to ask everyone to hold your questions until the end. After the presenters have given their information, I will facilitate a question and answer period. I'd like to introduce Dr. Jeff Berger. He's the Guest House Medical Director and the designer of most of the protocols that we're using to keep this campus safe. Dr. Berger, it's yours.
Thank you, Jeff. I'm going to start with a little lesson in humility for myself and say that as a physician, I think there's been a lot of misinformation, information, and it's difficult for me to know where the boundaries are between the two. One of the things I do know is that the model, public health model that was chosen to address the COVID-19 epidemic was one which relied on lockdowns. And this method is resulting in a period of uncertainty about whether someone is infected or not for about 18 months. Whether that's sustainable or not, we'll all see, but that's what we're stuck with right now. That means that we expect this epidemic to go on for at least another 12 months before it finally burns itself out. So during that time, what do we know? We know that if someone is infected with the COVID-19 virus, is probably going to be anywhere from 2 to 14 days before they exhibit symptoms, if they do exhibit symptoms, and not everybody exhibits symptoms, which means that it's almost impossible to know whether anyone has been in contact with somebody who is potentially infectious. That has made it difficult for us here because it means that whenever anybody travels here, they are potentially exposed to someone with COVID. We have no idea whether they have been exposed or not, even if they've had a negative test prior to admission. So we've chosen here to institute a 14-day quarantine when people arrive in treatment, because we know that if they are going to have symptoms and they will develop them during that time, we're taking COVID tests on everybody either before admission or at the time of admission to screen out people that we know have an infection. So far, thank God, this approach has been working. Many of our patients here are over 60. Many of them have hypertension and many of them are diabetic. So we have a population here that has a lot of risk factors we know make for a bad prognosis if someone gets COVID. There's no proven treatments at this time for incidental, what I would call incidental infections. There are a few medications that are available for people who are hospitalized and on ventilators, which might show some improvement in mortality. But we really don't have any way to safely treat anybody and who is an outpatient with this disease. Therefore, what we've done here also has been to raise the consciousness among our employees and associates about the possibility of encountering COVID. We're doing vigorous screening of staff before they come to work on a daily basis, taking temperatures, the oxygen levels, asking questions about possible symptoms. And so the consciousness on the part of the staff has been very high. We have had people exclude themselves from coming to work for a period of time, but so far none of those people have actually tested out positive for COVID. So again, we've been very blessed here, using the best that we can of our medical scientific knowledge and common sense and the good Lord's help. We've not had COVID here.
Thank you, Dr. Berger. I've asked our Director of Nursing, April Donaldson, to talk a little bit about what the protocols are that we're using with staff on a daily basis to monitor and to guarantee that we don't have COVID come into the facility. April?
Hi, everybody. Just to review some of the daily things that we're doing within the nursing department. As Dr. Berger mentioned, we are doing daily monitoring and screenings for all staff and all clients. We're checking temperatures, we're checking the oxygen levels, we're doing the recommended CDC questionings, the screening questions, any cough, any shortness of breath, any knowingly being in contact with anyone. So we're really being diligent every day to try to keep guest house as safe as it can be. We have all of the PPE, as we call it, the equipment that we need, masks and gloves and gowns, everything that we need to protect the clients and the staff when we need to be in the isolation unit. We're following all of those protocols as well. So far, like Dr. Berger has mentioned, is that we haven't had any incidents here, so that's good. And we're constantly double checking with if any regulations or recommendations have been changed. And thus far, things have been going along pretty well. The clients seem to be pretty okay and relaxed with the process. We've been very open with the communications and why we're doing what we're doing. I do think that it will probably go on for quite some time, but we will continue to follow the regulations and the recommendations.
Thank you, April. As I talk to people around the country about doing admissions to this facility, and I describe what our isolation process is about, it's a relief to some people and a question for others. We're working very hard to make that time in the isolation unit as valuable as possible. And I've asked Dr. Robert Rinaldi, our clinical director, to talk about what that part of the experience is like. Robert?
Thank you, Jeff. So to talk about isolation and the treatment that we provide here at Guest House, before COVID, the first 2 weeks here, a potential admission would go through an evaluation period, roughly about 2 weeks of assessments and medical and nutrition and, a quite holistic and integrated evaluation before we recommended any type of treatment or stay here at Guest House. We are now, even with isolation, taking advantage of those 2 weeks and making sure that those 2 weeks are productive and useful as part of that evaluation. So our treatment here has not changed. The difference is how we deliver that treatment. So once a client comes in, is admitted into the isolation unit, I myself go in, make sure that client has all the technology and all the resources that they're going to need throughout the entire 2 weeks. The therapeutic staff, the therapy staff are meeting with the clients via telehealth. We have a new telehealth platform, and we're using technology and technology-driven methodology to provide those services, those assessments, provide that evaluation over the 2 weeks so that we make sure that that isolation period is not completely isolated, that they have some connection with the therapeutic staff, as well as things to do that are going to be important for them after the 2 weeks and be important for us as far as our recommendations are concerned. So isolation for us has been a challenge, but it has also ensured that we continue the same type of high-level evaluation and high-level treatment that we have here at Guest House.
Thank you, Robert.
Thank you.
That's the best synopsis that I can provide today about how we're doing this. I'd like to just go around the room of the other participants that are here and answer any questions about this. We're working very hard to be as transparent as we possibly can about what this process looks like. We interact with clients and referents before they arrive so that they have an understanding of what to expect. But let me go around the room here. Sister Jenny, are there questions that I can answer for you, or that a member of the team can answer for you? I believe you're still muted.
There we go. Thank you. Thank you so much. This has been really helpful because I did have some questions related to, you used the term isolation, so I know that's a little different than quarantine. So, so I'm glad to hear that as a person in leadership, I'm glad to hear that that's how this is happening. My thought was, and is, how grateful, because as a leader, as you know, in these difficult times, a person's addiction may rise to the surface even more in these very troubling times. So it's good to know that there is a place where people can feel safe to go. So what you've described for me today has been really, really helpful, particularly what happens during that 2-week in isolation, that person just isn't necessarily separated, but there's really evaluation time and activity going on. So I really appreciate what you shared with me. Thank you.
Thank you.
Thank you.
Father Brian.
Great presentation. I'm concerned, my question was about basically what we're doing here in the Zoom universe. Are the clients being well-versed in Zoom recovery meetings when they're on campus and to prepare for their discharge, because it's going to be a long time before face-to-face meetings are going to be back with the general population? And just some thoughts about that. Thank you very much.
Robert, would you be able to describe what we're doing with clients to help them transition into this change in the recovery universe?
Absolutely. So we have set up a couple of different Zoom type meetings. And I actually wrote out a really descriptive instructions on how to keep privacy and how to make sure that even if you don't want your face shown, you can turn the video off, the recordings, making sure it's not recorded, things as such. A lot of the other meetings that we're having are actually phone meetings. We've also increased the use of alumni to Guest House. So we do have alumni calling in to some of these meetings so that the clients are part of a larger group, as well as alumni that are out there in the world being part of our group, right? And really making that connection and being able to support each other through this difficult time. So the clients have been well-versed in the use of Zoom. We also, again, are using other methodologies, other methods of getting out to meetings, although we've stopped going out to meetings in the community, but we have these phone meetings, we have Zoom meetings, internal meetings as well. So a multitude of different ways that we've been able to continue to have these meetings and continue to have the clients be participating in these meetings throughout the entire week and the entire stay that they're here.
Thank you, Robert. Sister Rita, anything that we can clarify for you?
I think I had a similar question. First of all, I have been on the scene here in California for 2 weeks, so I'm still learning a lot. But we just had a sister return yesterday, and my concerns also were what happens these 2 weeks while she's quarantining, the help. But I think that the question was answered already, how you keep them engaged these first 2 weeks.
Thank you. We've seen a lot of developments in the technology surrounding this. I fully anticipate that we're going to see a lot more developments. My take on this is that we're going to be doing a lot more internet and technology-based interactions for recovery. I don't see large groups of 12-step people getting together again anytime soon. And so we have a group of people in the organization working on how we're even going to further enhance our ability to do that. And we really are talking about how we're going to take our entire continuing care program online. And you'll be learning more about that in upcoming presentations.
Okay,
Father
great.
Mark, any questions we can answer? You are still There we go.
There you go. I was just wondering, Jeff, about the intervention services that are offered during the time of COVID. I know you've been so good in the past about coming to dioceses and orders, but is that still possible, or have you switched to online intervention?
We will still do an in-person intervention if that's what the scenario calls for. I've done, to this point, almost entirely consultations online with Zoom. Zoom, or there's another platform called Doxy, which is a little bit more HIPAA compliant. Guest House will still send somebody out to do the intervention if that's what is most necessary. The majority that we've done so far have been through technology, and a year ago I wouldn't have believed that it could be effective, but it in fact actually has worked quite well. I'm pleased with the way that it's turned out.
Thank you.
Deacon Stephen.
Good afternoon, everyone. Good to be with you.
Hello.
Jeff, I would just ask if you could reiterate, when making an admission, who's the first person that we should call, considering the adjustments that you've so nicely outlined, you and your team at Guest House? Is there anything different about the process from my end as a referent? Thank you.
At this time, I'm still handling all of the admission calls. So if you have my contact information, which is on the internet, you're welcome to call me. If you call the front desk at Guest House, they're going to direct you directly to me. If you send an email, it's going to end up on my desk. Based on all of the things with the isolation unit, the medical department, particularly April Donaldson, are getting involved a little earlier in the process than they used to. But other than that, you shouldn't see any change in how our admission process works.
Thank you for that clarification.
Thanks, Stephen.
Mm-hmm.
All right. I want to thank everybody for joining us today. This is some information that I think that it's valuable for people to understand. And I just want to reiterate that our priority is to keep everybody in our care as safe as possible, that we are using what we consider to be the gold standard of safety. And we're going to continue to do this isolation process until we have a much clearer understanding of what's happening, and we can have a greater degree of safety in admitting people. It's a little bit cumbersome, but we want to make sure that everybody stays safe. Thank you for participating today.